Mr. President, I come to the floor today as a physician who has practiced orthopedic surgery in Casper, Wyoming for 25 years. And I come to offer a second opinion on the health care bill that was recently passed and signed into law. And my opinion on this bill, very different than what I've heard from the administration, from the Speaker of the House, from the Majority Leader, because my opinion is that this bill, now law, is going to be bad for patients. Bad for the patients all around this country. Bad for health care providers, the doctors, the nurses, the folks who work in our hospitals, the therapists. And I believe it's going to be bad for payers, the taxpayers, people who are going to be left with this large bill to pay for a bill that isn't to save a health care system, but to create new entitlements and new obligations. And as I look at this, it really struck me, Mr. President, last week when they were having the debate in England. They're having an election, and the candidates for prime minister were having a debate. It was the first national televised debate ever in England in an election. They compared it to the Kennedy-Nixon debate when people were up there debating and discussing, and the question presented to the Prime Minister of England was, what about the National Health Service? Those of us on my side of the aisle have been very concerned, Mr. President, that with this new law, we are going to be seeing a nationalization of our health care in a way like we're seeing in other countries, whether it's Canada, whether it's England, and a system that I think is not what the American people want. But I wanted to read to you from the transcript of the debate, because they asked the Prime Minister, Gordon Brown, about the National Health Service. And he said, "My priorities for the health service are that we give people personal guarantees." So this is what he's promising, personal guarantees that every individual patient will know that they will get a cancer specialist seen within 2 weeks if need. They'll get a diagnostic test within a week and the results to them. They will also be able to know that their operation, so now they know they have cancer, that their operation will be in 18 weeks if you're any patient in need of an operation. So here you are, you've had your opportunity to see a cancer doctor, you've had your test, you have your diagnosis, and what is the best that the people of England are being promised by their Prime Minister? The best that they can expect is to have an operation within 18 weeks. The question here is, how many Americans, how many members of this body, how many people across this country are going to see that as satisfactory? Because that's where we're heading with this health care bill that's now signed into law. How many people want that? You'll have your operation in 18 weeks. So here you are, if you're diagnosed next week in the United States, if this were the situation they have now in Britain, you would be looking at having your operation in September. See you in September, come back for your operation. Now you can worry about it. You can worry about your diagnosis of cancer the rest of April, all of May, all of June, all of July, all of August. That's what the candidate for Prime Minister and the current Prime Minister of England is promising the people of that country with their national health system, a system that is the model of many people on the other side of the aisle of what they want American medicine to be like. This story once again demonstrates that coverage does not equal care, because everyone in Britain has coverage, but they sure can't get care. So then you ask yourself, does it really matter? Does 4.5 months, 18 weeks of waiting for your cancer surgery really matter? Not just the emotional worry of, is that cancer spreading within my body? Should I leave the country of England and go to the United States where I can get immediate care? But you have to worry because the statistics back up the fact that the care in the United States is much better than it is in England. Not that the doctors are any better here than they are in England, but that the timing of when you can receive the care from those qualified professionals is much better in the United States. So if you take a look at the statistics behind this, the researchers that look at this, and I'll just go through it because my wife is a breast cancer survivor. She's had a series of 3 operations, been through chemotherapy twice, and she is now surviving 6 years after her diagnosis. And I'm grateful that she was treated in the United States. where the day after the diagnosis was made, they wanted to get in immediately to do the operation. So let me just tell you, Mr. President, it says, today the United States leads the world in treating cancer. Scientific studies. With the breast cancer, for instance, the survival rate after 5 years among American women, so a woman diagnosed in the United States with breast cancer, treated, 83%, still alive 5 years later. For women in Britain, 69%. Where do you want to get your care? The bigger question is, when do you want to get your care? For men with prostate cancer, the survival rate, 92% in the United States, 74% in France, 51% in Britain. American men and women are more than 35% more likely to survive colon cancer than their British counterparts. And in an article from the August 2008 edition of Lancet Oncology, the cancer journal there, the United States is #1 again. In almost every category, Americans survive cancer at higher rates than patients in other developed countries. American cancer patients have a higher survival rate for every major form of cancer than patients in Canada and in Britain. American women have a 35% better chance of surviving colon cancer than British women. American men have an 80% better survival rate for prostate cancer. American survival rates are also better than survival rates in France. And you can go on and on with this, Mr. President, but it is evidently clear that the timing on when one gets their care is critical. Now, it is interesting to me, Mr. President, that just this very week, the President has made his nomination for a new director of the portion of Health and Human Service Department that deals with Medicare and Medicaid. The President's been in office for 15 months. We have had a debate and discussion in this body for almost all of that time on health care. This body, the Democrats, have voted to cut Medicare by $500 billion from our seniors who desperately depend upon Medicare. Why is it that the President has waited 15 months to finally nominate someone to be the head of the part of government that oversees Medicare and Medicaid? The President has put 15 to 16 million more people on Medicaid, has cut Medicare, has told us that we can trust him on this, but yet he would not put somebody up to go through the confirmation process to head Medicare and Medicaid. Why? Well, in my opinion, he didn't want anybody to answer the questions because they're tough questions. Why wouldn't you nominate somebody for all of that time, leave the post open essentially, and not have somebody to come to Congress and say, what are the implications for the American people of dumping another 16 million people onto Medicaid, of cutting $500 billion from Medicare? Well, because the person he put in has a long history of a love of rationing of care. It's Dr. Donald Berwick. He has a history of support for government rationing of health care resources on the grounds of cost. Not on the grounds of quality, not on the grounds of survivability, but on the grounds of cost. And he has said, as recently as last June, the decision is not whether or not we will ration care. He said the decision is whether we will ration with our eyes open. So here we are. The newly nominated person has said, I'm going into this to ration care. Now, he's a big supporter of what they have going on in Britain right now. In Britain, they call it NICE, stands for the National Institute for Health and Clinical Excellence. Well, this is what Dr. Berwick has said about it. He said that those organizations are functioning very well and are well respected by clinicians, and they are making their populations healthier and better off. Well, let me tell you what a London doctor, a colon cancer specialist, had to say. This doctor said, a lot of my colleagues also face pressure from managers not to tell patients about new drugs. Said there's nothing in writing, but telling patients opens up a Pandora's box for health services trying to contain costs. He further went on, this now being again Dr. Berwick, saying NICE, this British group, is extremely effective and conscientious, valuable, and importantly, knowledge-building system. Well, what did the BBC, the British Broadcast Group, say? They say that doctors are keeping cancer patients in the dark about expensive new drugs that could extend their lives. A quarter of the specialists, 1 in 4 specialists polled by a journal on melanoma in the United Kingdom, said that they hid facts about treatments for bone marrow cancer that may be difficult to obtain from the National Health Service. Doctors said they did not want to distress, upset, or confuse patients if drugs had not yet been approved by the National Health Service drugs watchdog called NICE. So you take a look at the British healthcare system, 18 weeks of a wait, which is the promise from the Prime Minister in the debate last week, 18 weeks from when you're diagnosed with cancer till you have your operation. That's their aspirational goal. It makes you wonder what it is now. Has to be a lot longer than 18 weeks. So, Mr. President, I would tell you it's no surprise that in the latest polls that were out this morning, the Quinnipiac polling just done this past week, do you support passage of the health care reform bill? Less than 4 in 10 Americans, only 39%, approved what this body crammed down the throats of the American people, whereas over half of all Americans disapprove of what this administration, this president, Harry Reid, Nancy Pelosi, and this Congress has now forced upon the American people. The American people have great cause to worry about what they are going to face in their health care decision, if they're going to be able to keep the doctor that they like seeing. Those are the questions, and those are the concerns of the American people. And now, Mr. President, you know my second opinion on the health care bill, that we were told by Nancy Pelosi, you have to pass it before you get to find out what's in it. Thank you, Mr. President, and I yield the floor.